October is Breast Cancer Awareness Month, and there's so much vital information out there that we really need to know. And here to tell us more about it is Dr. Victoria Mango and registered nurse Beth Battagalino.
Breast cancer is still the second leading cause of cancer death in women, and approximately 42,000 women in the United States are expected to die of breast cancer in 2020. Breast density, which is a lesser known risk factor for breast cancer, which should be considered in addition to other more widely known risk factors such as family history or genetic profiling, is an important consideration. Women should understand whether or not they have dense breasts. And if you do, it's an additional conversation with your healthcare provider, figuring out if you may need another type of screening in between your mammogram to detect breast cancer, which is why we're here today.
Now, you touched on the topic of dense breasts. How can someone tell the difference between a normal breast and a dense breast?
I'll turn that over to Dr. Mango.
So that's a great question. So we really want to empower women to know about their breast density. And the only way you're going to know that is by having your regular mammogram, having a discussion with your doctor, or just reading the mammogram report. And we want women to be aware of this information so that they can have a really informed and empowered discussion with their doctor. So if you have dense breasts, it's extremely common. About half of women in the United States do have dense breasts, and it's not abnormal. It's something that we very commonly see. But if your breasts are dense, a mammogram may not be enough to find breast cancer. You need to have a conversation with your doctor if additional screening might be warranted.
Now, I know you touched on the fact that, if you are one of those women that happens to have dense breasts, that you should check in with your doctor. Is there anything else that women should really know during this month? Because I know that screenings can vary. And how early should a woman actually look into getting screened?
So that's a great question. We follow the guidelines of the American College of Radiology and the Society of Breast Imaging. And what those guidelines say is that for someone of average risk, you should start having annual mammograms starting at age 40. And once you know whether or not you have dense breasts, you should have a conversation with your doctor to see if, in addition to the mammogram, you might need supplemental screening. So things like an ultrasound or an MRI might be warranted.
And when it comes to signs and symptoms, I know that mammograms obviously are prevention, and it's key in getting to it faster. But do you have any advice for women as far as what signs or symptoms they could be looking for when it comes to Breast Cancer Awareness Month?
So women should be very aware of any changes in their breasts. So things that we look for are changes in the skin, changes in the nipple area, feeling any lumps, any thickening, any changes in the breast. It's really important for women to know what is normal for their own body. And if they do notice a change or question a change, that they bring that to the attention of their physician so that it can be evaluated appropriately.
Absolutely. And I think, as we mentioned, prevention is definitely key. So, Doctor, can you tell our viewers where they can go to learn more information?
So for more information, visit understandyourdensity.com. Take the quiz, understand whether or not you may have dense breasts. And for more information on breast health, visit healthywomen.org.
You can always find this segment and more on our website at firstcoastliving.net.